If they ask you the disease associated with Staphylococcus, what and all disease will you write? Okay, let me tell you. You have to write cutaneous infections, pustules, boils, carbuncles, abscess, pemphigus neonatorum, burns, infection. Whenever there is burns, it will infect that opportunistically. Deep infections, what and all you have? Osteomyelitis, tonsillitis, pharyngitis, sinusitis, pneumonitis, endocarditis, we already told you for epidermitis, right? Yeah. Meningitis, septicemia. Don't forget urinary tract infections, okay? Then, especially these are opportunistic infections, urinary tract infections. As we have already told you, food poisoning, it can cause 2 to 6 hours within the ingestion of the food. You can see a reaction. Nosocomial infections, mainly hospital acquired infections, you have to mention Staphylococcus aureus. Don't forget this. Okay, hospital acquired infections. Food poisoning, Staphylococcus aureus, you should not forget. Then what else? This one, endocarditis, I already told you. For what? Epidermitis, right? Urinary tract infections, these are opportunistic infections when you do especially local instrumentation, right? You can write all this, pemphigus neonatorum, all those things that we learnt, right? Bullous impetigo, staphylococcal scalded skin syndrome, Ritters disease, write all this. Actually, they have put it again under the skin exfoliative diseases, which we have already seen, right? Bullous impetigo, pemphigus neonatorum, all these skin exfoliative diseases. Bullous impetigo, pemphigus neonatorum, Ritters disease, staphylococcal scalded skin syndrome. All this you have already seen, right? Let me just highlight it for you so that you won't forget during your last revision. Then, tampons cause what? Toxic shock syndrome. Has already been discussed for you. Don't forget that. Then, so I think that covers all the diseases from Staphylococcus. They can cause pus, okay? Remember, pus creating infections they are. Now, pyogenic, right? That's what we say. So, what and all did we learn? Cutaneous infections, deep infections like endocarditis, urinary tract infection, food poisoning, 2 to 6 hours, nosocomial infections, that is hospital acquired infections, skin exfoliative diseases, that is we saw bullous impetigo, pemphigus neonatorum, staphylococcal scalded skin syndrome and Ritters disease. Then you have the toxic shock syndrome with the use of tampons, etc. Okay, so how do people actually get this infection? You know, the main thing here is carrier. This word you should not forget. Because many people, hospital staff, they are carriers of Staphylococcus aureus. Okay, just by touch, direct contact, or or through some other vehicles, they become carriers. 50% of nursing staff they are carriers. Such a shock, right? Even healthy people carry this bacteria in the nose. Okay, they are carriers. Some people carry it in the skin, throat, etc. And many of these are so where do people catch this infection? Hospital infections. At least one person, they say, dies in the hospital because of the hospital acquired infection, that is Staphylococcus aureus. Bacteria are often antibiotic resistant, right? That's another problem. We'll come to that, how it happens. Where exactly the people pick up? Intensive care units, in nurseries and post-operative wards, operating rooms, chemotherapy wards, burns unit. All these places people get infected by these strains.